Welcome back to the show. I hope you're enjoying the reports. It's now time to enter into our discussions. I told you our discussions today will be quite interesting, though it has to do with a bit of the social anomalies around us, which it's seeking kind of acceptability in society. You know, one of the largest conversations in the world today happens to do with the LGBTQ and many of those sects. But now pedophilia to itself is already coming into the conversation, and many are looking at the fact that can it be accepted into society as well as the LGBTQ and the rest, and can it really be accepted by people and all. So we're going to look at the pros, the cons, because when it comes to conversations like this, you know, a lot of people have their bias, and today we'll be looking at it from the psychological perspective. And to that effect, we have a psychiatrist in the studio with us. He happens to be a mental health professional, and yes, he's also here with us to discuss with us today, ladies and gentlemen, in the person of Dr. Akinwumi. Welcome to the show, sir.
Thank you very much.
I hope I did not make a wreck of your name, actually.
Yes, Akinwumi, that's right.
Thank you very much, actually.
You're welcome.
It's nice having you in this conversation,
yes,
actually.
Nice.
Like I said earlier, before we started, when I was introducing, when I said I talked about the fact that it used to be a social anomaly, but now it's something that many are bringing to conversations, both in the Western world and in certain countries, that it should be accepted by society. In the yesteryears, we talked about things like LGBTQA and many of the likes, pedophilia and all. They would think the person is, you know, psychologically imbalanced. But now there are conversations around the West, around many quarters within the world, even in Africa right now, talking about its acceptability. What's your take on it?
Yes, largely, taking backgrounds into consideration, it is still social anomaly, in my personal view. But being a professional, I have robust information, knowledge around it. And in as much that I am personally not comfortable with it, I will not be involved, and I will not be happy seeing somebody close to me involved in it. I may not judge anyone that decide to embrace those practices.
Wow.
Yeah.
I know George was quite enthusiastic. I know he just wants to jump into the discuss for the morning, but not everybody really understand what is pedophile means, you know. So why don't you give us a general understanding of what this concept means and understand the nature behind this behavior generally.
LGBTQ is a composite name. It's an umbrella name that include the different group of people who seems to have problem with their sexual orientation, with their sexual identity, with their gender identity, and they are seeking approval of the society to allow them to express what they feel is normal for them. But this sexual orientation and identity they are trying to embrace seems to be in contrary to what most society readily approve or readily are comfortable with. Having said that, the discussion around it has been for decades, has been a long time discussion. And because majority of us are straight, majority of us are, in quotes, normal, few people that are coming with this idea are usually met with some resistance, with some disdain, with some condemnation. But quite a number of them, or this group, they are gaining ground every day, especially in Western society and even in our society. They now have a group, they now have stronger voice, they are now speaking out, and this identity are all written on them, they are not hiding it again. So this is LGBT, and we talk about the most acceptable, what is taken to be normal by society is that God has created us a man and a woman. So we are men, we are women, in structure, in behavior, including sexual behavior. Now we have some individual who are obviously, we all know when we see a male, we all know when we see a female. But some male, we want to have sexual behavior of a female. As some female said, what they feel like, what make them happy, what they are comfortable with, is to behave sexually like a male. That is when we talk about lesbian, when we talk about gay.
Yeah.
You understand? While some are even gone kind of mixed things up, we call them bisexual.
Bisexual.
They still relate with a man, we still relate with women or a woman, and but at the same time still want to have sexual interaction with co-men. Or a woman who relates well sexually with men still want to have sexual interaction with co-women. So we call them bisexual. It is still under this LGBTQ. Then we have some called transgender. They are not only saying their sexual orientation and sexual interest. A woman is not just say with another woman now, but they are trying to transform. A woman now wants to transform to be a man, while somebody born as male wants to transform physical and even sexual organ and activities to become a woman. We call them transgender. Then we have some called queer or questionings. Those ones are also not heterosexual. That is, they are individuals that are not attracted and fascinated by opposite sex, but they will not classify themselves as lesbian or gay. This is quite very complex. There are some dynamics that they feel in their body and make them want to behave like opposite sex, but they will not come all out to say I'm a gay or I'm a lesbian.
But looking at the one which we want to really base ourselves on today, pedophilia. What's your take on pedophilia in itself as an act? Because to a very large extent, I think that one also has a bit of ground gaining as we speak in some parts of the world.
Yes, thank you. Pedophilia is completely different concept. It is not under LGBTQ concept. So maybe we want us to put the LGBTQ aside.
Let's put that aside first.
And let's focus on pedophilia. Yes, pedophilia is one of many in a major group of, we call it sexual reference disorders.
Sexual reference
disorder, which we also call paraphilias. Paraphilias. And what happened in this major group of disorder is the fact that some individuals have sexual behavior around other individuals in a very unusual manner that is generally accepted, or have sexual relationship around some objects in a very unaccepted manner. And there are different types. One of them is pedophilia. We have necrophilia, we have urophilia, we have coprophilia, we have exhibitionism, we have fruitism, we have voyeurism, we have sadomasochism. All these are under what we call paraphilias. But focusing on pedophilia now. Pedophilia is just a sexual behavior in which an individual, an adult, has sexual attraction and preference for a minor or for minors, underage children. Preference. So that is why, you know, I call it, I say sexual preference disorder. So this individual called pedophiliacs now, they prefer to have sexual relationship with minors. And I agree with you that, and not surprisingly, from some Western society, I think US in particular, there have been discussion around it,
yeah.
That maybe maybe this is what these people, maybe this is not abnormal, maybe we should remove this as being a crime. There have been that discussion. I think I also came across some discussion along that time the other time. But yes, there have been some socially unacceptable behavior in the past that in a way it has gained ground, and some people have come up to campaign in favor of such behavior, and has been normal behavior today. You get my point now?
Yes.
So people are now coming to say this, but when we look at the concept of a minor generally, I wouldn't understand how. I wouldn't be also surprised when that kind of discussions came through, and before we know it, they say it's not problem. I would be surprised. But I wouldn't understand. So I wouldn't understand why that discussion should come up in the first place, and why it should actually gain acceptance. Because we know minor cannot give consent. And from the angle of consent alone, it is not an acceptable behavior. We have defined minor to be of a chronological age that have not developed an independent mind, that does not have mind to make decisions, safe decision. And as such, having relationship, sexual relationship is one of the very basic human relationship and very powerful relationship, such that it will be a problem when you have capacity to make decision, when you have ability to give consent to explore your sexual behavior the way you like. But when an individual's sexuality is violated, even though the child may be seen to be cooperating, may be seen to be enjoying it, may even be seen to be the one running after this person, it is still taken like violating the essence, the psyche of that child, because many of them will grow up to see trauma in what has been done to them. And that may, even in the future, destabilize their psyche, and many of them may be actually grappling or struggling with serious mental health issue.
Now, in all honesty, topics as this is topic we generally tend to shy away from as society. So allow me ask, what are then the statistics as to the prevalence of pedophilia, and how common is it now in society? Maybe in Nigeria, how common is it in Nigeria?
I don't have specific figures in terms of fractions or percentages. I don't have. But I know that is a very common practice. We hear every day. Most of them, it's actually overlap with rape. You see quite, and we hear that one every day. And almost for everyone, one case we hear on media, social media, television, there have been things happening in the society that did not gain publicity. So it's quite common. Pedophilia, rape is quite common in every society, and there are many factors that encourage it, and one of those factors is overcrowding. Overcrowding, where you have people, you see it in every social class, high social class, low social class, but you see it a lot in low social class. Poverty-ridden environment where boundaries, privacy are not well defined. There are no boundaries. People just live together. Children are everywhere. You can send, buy something for me in the adjacent houses, and going around, you see underage children, 7 years sometimes, hawking in some neighborhood, selling orange and all those things, and things like that strive in such setting. So it's a common thing, but I don't have specific figures to give on that.
Let's go to something a bit deeper on this. What do you think? Because you said something that you don't really see why what is there in the body of because one of the things I was when I was trying to study about many of these things that we used to term social anomalies is the fact that there are little or no scientific proofs to whatever they are talking about, except for they say, you know, according to many of the things they talk about is either mental or psychological. Now, looking at it, the physical feature of a young chap. Now, I know it doesn't just happen to young ladies only, even young guys too, but men don't, you know, as men, our mouths are very short. But with women, it's very rampant. I know that, and I asked myself a question: what's in this young lady now that you are saying? She doesn't even have the full features of a full-grown woman, but you are kind of attracted, or there is this mentality. You know, there was a time I sat down with friends and we were even talking about fantasies. I don't know. So far, so good. We've dealt with mental health issues across. What do you think is wrong with the mentality, or what do you think is the mental framework of people involved in such kind of acts that makes them more attracted to?
Yes, thank you. You mentioned what is it in their body that they don't have those features. I remember some years back, over a decade, I was reading a book generally on sexuality, and the opening statement in that book says that there is no single documentation, no matter how comprehensive you want to make the documentation, literature or any book, that can exhaust the entire spectrum of sex. Sexual behavior is so broad that we continue to even to understand some of the behavior. You know, when I was talking about sexual preference disorders, I mentioned quite
a lot.
I
was even interested in this.
And some of them you just be wondering why. Masochism. Why will I need to be completely beaten and humiliated before I enjoy sex? Sadism. Why do I need to inflict injury? Sometimes you have to see blood before you enjoy sex.
BDSM.
Necrophilia. Why is it that dead body is the one I want to have sex with? Those explanations are not the one we should be discussing now, because some of them we are yet to even find explanation to them. Some of them are closely related with mental illness, clear-cut established mental illness. So you see, larger fraction of people involved in these disorders having one or two other specific mental illnesses, which may most times psychotic disorders. You understand? But we have seen some individuals who are not known, who have not been diagnosed to have another specific mental health condition, but mental illness is not far around them, showing that there is something about their reasoning. It is not when one is completely dysfunctional or disorganized, overtly disorganized, that we say somebody is mad. There are many people whose reasoning, whose mental health is very reasoning and mental health is very subnormal. We see them around, they look good, they speak, some of them very smartly, speak very logically. So when we talk about mental illness, it goes beyond somebody who is disorganized and is jumping everywhere and is showing some overt symptoms. Some don't, if some have mental illness and they are at school and you don't even suspect any problem. But even apart from that, some don't have mental illness, but they don't have mental wellness.
That is, they are just in the middle.
You get now. There is what we call mental health and mental wellness. You must meet the criteria. Some don't meet the criteria, yet they don't. They may not have specific mental illness. You may find quite a number of such in hanging between all these sexual preference disorders and things like that. But most cases of these sexual preference disorders, they are abnormal behavior. Some of them are specific diagnoses that you have it. Some of them are even crime, like exhibitionism. Exhibitionism is to expose your nakedness to unsuspected people. If you do that, you can be harassed, you can be arrested for causing sexual harassment and causing public disturbance. Like what is it now? Voyeurism, where you be peeping on neighbors. Some will even use telescope, and when I'm in my room, I can decide to walk from my bedroom to my bed naked, but you are using telescope to see their nakedness. Once you are people are, so it's crime, and at the same time it's an abnormal behavior. So coming to pedophilia, like I've said earlier, pedophilia is part of paraphilias, sexual preference disorders. Some discussion wants to pull it out. You understand? So when it is pulled out, if I thought they are able to achieve it, it will now not become abnormal
anymore
behavior again on on papers. And that will have far-reaching effect up to the court case, level. Because there will have been documentation, some scientists will have come out, there will have been some big English around it, and those countries will have probably reviewed their constitution, and people will consider it is not abnormal behavior. But as it is today, in our own environment, such discussion, I will not say it will never come up in our environment, but it's not what will come anytime soon. So it is an abnormal behavior, and it's a crime in our environment.
Now, we know pedophilic tendency, somehow it has to do with grooming and manipulations. I'm really curious as to some of the tactics these predators tend to use in grooming their victims. Should I call it victim at this point?
Yes, they are victims.
Victims,
yeah.
You know, how do they manage to, groom and manipulate? What are some of these tactics?
The tactics is simple that they use. I remember when I was in medical school, a friend of mine was suspected to have that tendency, and I particularly will stop him. We just see him playing with the children of our landlord. We're staying in a BQ, playing with the children, putting them on the lap, and some adult around will not suspect anything. We just think they are just being nice, they just love children. These are people that you will notice they are overtly you notice they really love children. They show it, give them gifts, and children around adults that give them gifts.
Yeah, they always
you go out, you buy nice biscuits, chocolates, things like that. You see your children come and watch cartoon. While they are watching cartoon, you give them small coke, and then that is what they do. And the children are so naive, and at some point it will change the attitude of some children immediately, and some children will be resistive immediately, while some will even be enjoying the play. So do not carry them, touch them intimately, because they are children, but they are human beings too, and all those sexual responses are already developing in them. So when you touch them, they feel those responses, while some children may be confused and be like, what is this? Maybe this is not normal, maybe this is strange, and you see that confusion on them. Some of them, if they have very sensitive parents, they can actually pick that something is happening to this child around that time, while some may not even show much of confusion but play along. They will not even be the one going and even start touching the adult intimately first with time, and they grow up into that. So that is it.
In fact, it's kind of fascinating, kind of scary. But I want to ask a question actually, but before I ask the question, I'd like us to go on a short break where we'll take the goal start for today. After goal start, we'll be back to continue our discussions. Please stay with us, we'll be right back. Welcome back to the show. If you just joined us, it's still Daybreak Africa, and yes, I hope you enjoyed the goal start. Actually, I hope you're inspired to do something very productive this particular morning. Well, before we went on goal starts, for those that have been with us and for those that are just joining us, we are on a very interesting discussion on some social anomalies, focusing majorly on pedophilia. And our Dr. Akinwumi Akinnuoye is still here with us, actually discussing. Now, you talked about the place of grooming, and it's kind of scary the way you analyzed that particularly. And for things like that, I don't know what happens from your own hand. You've dealt with so many people. What do you think happens to be the after effects on many of the victims, or maybe even the perpetrators, after those acts are done?
Yes, thank you. The after effect is huge, and many people don't know that it's very huge complications when a child is exposed to that kind of experience early in life. The after effect can be physical, but the one we are really worried about are the psychological effects. Physical in the sense that some of them, this thing happened to even a child as young as 2 years, 3 years. And that can cause some damages to their genitals, to their sexual organs, and talking about physical damage. And those physical damage can be something as simple as just some laceration, small, that we may even heal without formal treatment, and some may require some little surgery, to an extensive damage to the private part that may require high-level surgical intervention to repair. Some of them, depending on the activities, the sexual activities of the perpetrator, may even lose their life in the process of exposing children to such behavior. Now, talking about the psychological, I said something earlier that almost immediately some of them are confused. You see it, their behavior will change at home. They may be restlessness sometimes from the pain due to the physical damage, but sometimes they may not even have physical damage, but they may not even be from, but they have experienced something that they don't understand. They have experienced something that has left huge blow on their psyche, and their behavior change at home. Some may be withdrawn, some may be deviant, some may just be misbehaving at home. The behavior will change, and after some time, it depends. If the exposure continues, then the child may at some point show more disruptive behavior, that the family may now be like, there is problem, let's go and see a counselor, let's go and see a doctor. Some of them may just go to a general doctor. Some informed doctors will know that they need to refer them to a psychologist or to a psychiatrist. Then when you interview them, you now get some of these things. Some of them will say they are what they've been passing through. And for those that have loving, caring, sensitive parents, when you see such child down and you try to find out, they will come out and say what has been happening to them, and they will. But some children will continue in that act, will be exposed to such for a long time. Many of them will grow up to have serious damage to their mind. And when I say serious damage to their mind, I mean very serious damage to their mind. And this damage varies widely. They can have problem with their own sexuality as well. They will now become potential sexual abuser themselves in the future. Some of them may have what we call sexual promiscuity as an adult, while some may have sexual aversion. You just see some of them now grown up at the age of 25, now married maybe at the age of 28, 30, and have not had sex again. They have been together, let it even be in a church kind of relationship. They may be like, okay, maybe no sex before marriage. The brother too, if the brother loved the sister very well, they cope. Now they are married 2, 3 years, no sex. They now have sexual aversion as a result
of that
of the events in the past. We have seen quite a number of such. So they either become sexually promiscuous or sexually aversive. You understand? Some will even have what you call vaginismus. Vaginismus is a condition in which an adult now who is willing to have sex cannot have sex. Not that he does not, he is willing. Anatomically is okay, physiologically is okay, but in the process of mating, you just notice that you cannot have sex because the entire muscles of the perineum of the genital go into intense contraction and penis cannot enter. And the few cases I've seen, maybe up to 3, 2 of them have had serious sexual abuse. One not as a child, one was at the age of around 18-20 years when she gained admission into university, while the other one had serious sexual abuse as a child. You understand? So you can have those. Then they can have, apart from that, they can have post-traumatic stress disorders,
PTSD.
they can have anxiety disorder, they can have depression, they can have psychosis, they can have any mental health conditions. So that is why whenever I'm taking group of students, especially medical students, I almost take time to talk about rape when we are talking about sexual topics, so that they will know. Many don't know the impact. Many young people that are involved in rape are just being, they are just cashing their fun, if I can use that word. Some of them have some personality issue that they just want to dominate and show some kind of power over other people. But I feel that if some of them know the effect, what it can cause to their victim, maybe they will not do it. Cases of rape, cases of pedophilia has a far-reaching effect on the victim. Yeah, a good fraction of them will not be fine mentally.
But
in adulthood.
I want to ask a question. In some cultures, in some religions, in some settings, moral settings, they don't really see the bad side of pedophilia. I wanted to go deep into religion actually, but I discovered that for the case of extreme sensitivity, let's just we know some of those things.
Yeah.
Even at some region, not just in the northern region of Nigeria, even in the southern region, we see instances where we call them child marriages. It happens. And I know of one case of a lady who, this one happened to be close to me because of the fact that she used to be my neighbor. We used to stay in the same street, and she was forced off marriage at, that was age 14, 15. And then she was just getting into puberty. Everything was just coming out, and the first time I saw her recently, and she is a total shadow of who she used to be. Now, looking at such, some now feel as if it's not that bad. What's your own take on it?
Yes, it's very bad. There's no way we want to look at it and wants to justify it, because the complications that I mentioned earlier are very strife in such community. You see many of them coming down with physical complications. Physical complication as a result of even the sexual activities. Physical complication, most of them cannot carry, they are not mature to even carry pregnancy. Many of them develop serious illness during pregnancy. Some of them even die. A good fraction of them will lose their life in the course of pregnancy. When they now want to deliver, they have serious problem. And many of them have to be assisted surgically. Many of them will not even go to hospital. The same tradition, try to do it locally, and because they are pelvic, their birth pathway are not well developed, you now see situation where the baby try to come out, and this will cause serious damage to, we call something VVF, vesicovaginal fistula, where the bladder and the vagina, there should be some wall that separate them, will be eroded and communicate. So when they want to urinate, it will enter into their, sometime to the rectum, and they smells a lot, and they require a lot of money to do corrective surgery. They are there, they don't even see the need, they don't even go to hospital to seek for the necessary surgical intervention. You just see them lying the streets, smelling badly. So recently we see some organization coming out doing free surgery for some of them. They will go and pack them in their different homes on the street to correct this. Then now talking about the mental health issue, you see cases of drug abuse among these young ladies while they are growing, because a lot of things is missing in their mind. They don't understand. And this is an environment where drug use is also very strife. Many of them have depression. Many of them are anxiety disorder. They don't know how to handle it. Some of them just feel when they take this substance, they make them calm a bit. So they from there also enter into the addiction problem. Some of them have mental health issue, including psychosis. It is just a messed up thing. So I think the media need to talk more. There have been a lot of discussion from different organizations condemning the act, and I am seeing some notable people that are well educated coming from this type of environment. They should speak out. These people have traveled widely. They have seen the value of allowing people to grow up, to get education. You now see many young ladies in this environment that have been to school. They do very well, becoming doctors, becoming accountants, becoming great women in the society.
They are only permitted to grow at their own.
And most of them are, except in the recent time where many more people are encouraged to go to school and things like that. But in those environments, they are the children of some privileged generation in that environment. And I expect those women and the men that are exposed there to come out and condemn that. So there cannot be way it can be explained in any tradition. It is a disaster that we need to stop.
Let's talk about a bit about victim profile. What are some of the common characteristics or profile of children who are being targeted by pedophiles, if any there is?
Maybe there is no profile for targeting, but we may have profile for sources, for the sources of the predator, for the perpetrator.
Okay.
Meaning, what I'm trying to say is that the perpetrator just, quite some of these perpetrators have serious psychological issues already. You understand? Some of them, not all, you still see some who can negotiate sex with another adults and get, but some of them have some self-esteem problem. I'm talking about perpetrators now, and they find it more comfortable, convenient to just buy sweet and biscuit for some children around, play music for them and lure them into, they find that one quite easy. Some of them, it is not just like a love or passion for a child. It's just what is convenient for them. You get my point now. So we have that. And they just target children generally. So there are no features for children they target. But there are features of, because some children will not fall. So the quality of training, the quality of care, the quality of love, the quality of relationship between parents and children is very important. How well your children are comfortable with you as mother or as father. You understand? How comfortable, what is the quality of home training? What is the quality of discussion you have had with your children? How are your children seeing you? And what is the quality of physical, material provision you are giving them? Some children, what do you want to give them? It doesn't freak them. Some, the parents are not particularly rich and give them a lot of things, but they have been trained to be contented. Some children have been trained that whatever anybody give you, don't even collect. Some training, and those children will do it. Some training is, you must tell me before you use it, bring it home. Those are training. So a child that is brought up in a very permissive environment, in an environment where parents don't have time, quality time with the children, in an environment where parents are not even mature themselves, where, you know, we have some young,
even if a young couple or a young child gives birth to a child, the maturity to take care of that child.
And so you have parents that should even be children themselves, and who now they now have child, they are not conscious of becoming a parent. You know, sometimes you have to be conscious of becoming parents. They don't have that consciousness. They are still doing a lot of things that the younger a child now is now looking. So it's not, they are not a good role model. You watch TV, very vivid, sexually explicit images program together with a child. You understand? And they are doing all those things. So even when somebody is trying to lure that child, he will not even see it as something bad that maybe my parents will not like this. He will not even see the need to discuss it with parents to rescue her from such activities that is brewing around her. You get my point now? So those may be features of a child that may fall. So while these perpetrators try to launch out their dragnet, which is just general, who will be caught in that dragnet is a function of some of these things we talk about. Some children will not fall because of the quality of relationship they have with their parents and training they have had.
One of the things that actually scares me the most is looking at the economic situation of the country right now. We are having a situation where these days there is this mentality that is passed around to many people now that, you know, in yesteryears we have the fact that, okay, the man provides, the woman stays home to take care of the child. Today the man works, the woman works. They both go out together, they come back in the evening. And most of these children are left with maybe a maid, maybe just dumped in the school, maybe boarding schools and all that. And we know that sometimes the major perpetrators, they operate during these hours, economic hours, where both parents are going to at least get what the children will feed on. And sometimes, even when we talk about the place of the pedophilia, the one of marriage, child marriages and co, like you said earlier, the privileged sometimes take advantage of the less privileged, or sometimes it's just a cultural thing of, okay, because I'm of an higher status, some of them don't even value the female child and all that, so they just give out based on less value. What my problem there is the situation of things. From your own view, what kind of a society are we creating, looking at the kind of situation we have around us? Because I'm beginning to view that more and more issues like this will tend to trend. And I from my own end, I'm kind of scared if the pedophilia itself is taken out of the list of abnormalities and is brought to normal. What's your own view of how society will look like with all this?
Yes, we have said it is a societal anomaly. It's an abnormality. And going by the outcome, the complications that I have mentioned, it's obvious that the future of the society is not bright if we should allow this kind of behavior to gain more ground, or if we should walk in the direction of normalizing it. It is grossly abnormal with all negative outcomes like we have been talking about. Yeah, you raised something quite very important that's worth just spending some time to discuss about the reality of our society now, where it is no longer that daddy will go and work and mommy will stay at home to take care of the children. We have father who is a career man, we have mother who is a career woman. Some are involved in a lot of business and traveling every time and not home from morning to night. We are seeing more and more of this, and this has huge negative impact on the family life, on the children in particular. Most cases of this pedophilia, rape, are with familiar people. They are with people close to the family. Most of them are family members. That is the setting. And anytime I told you earlier that I'm taking this lecture, I always signal warning to students or to anybody that is listening to me, or group of people listening to me. it is such that you cannot trust anybody. Yeah. As much as you can help it, make sure you are the one taking good care of your children. Not your sister, sometimes not your uncle, not your pastors, not your cousins. Most cases of pedophilia and rape are perpetrated by these people. By the people ordinarily you would not have imagined. And sometimes when it happens, you cannot even press legal redress. It's one of the reasons why most times they don't press legal redress, because this thing is affecting. How will you say your brother who have come to stay with you has now be sleeping with your daughter, 7-year-old daughter, and you want to go to court, and court, if it's in Lagos, it's life imprisonment. So many people don't even know how to press litigation for such development. So whatever we are doing, only that most parents that are this busy, they don't have time for children, they don't know the price, they don't know how huge damages, potential damages that if such thing happen that can cause, and all the money they are making and all the good life, the things they want to provide for the family will be meaningless. I have seen privileged people whose children are involved in things like this, or some not even things like this, but some other social vices that damage them. Big men, when I say big men, crying profusely right in front of my desk that all the things they have worked for, is it not wasted, is it not? So many of us don't know this. We must spend quality time with children. You must protect these children. They can't protect themselves. You can't be so busy and you are leaving your children for driver. I have seen so many patients that is their father's driver that have been violating them. I have seen some that are their pastors. That's one we also hear every day in newspaper or social media. That one is everywhere.
Very rampant.
So parents must learn. They must be very conscious of that potential anomaly, and they must learn how to take care of their children and protect the children. Because it is not just an act. Some people will say rape, sheko enjoy, and say oh jubelo. Many people don't know it is not just that act. The after effects
of the act.
Some will never be fine again in his entire life. Some. There was one of the university around, the patient came to me some times ago. This patient was gang raped. He's a guy, but as a child, by some ladies in their neighborhood.
Wow.
I think then he will be around age 15. He was just about leaving secondary school. Was gang rape, and the guy developed serious PTSD and could barely function. And there are many like that. So a good fraction of these people, a child that an adult is just having sex with, for that adult we call it pedophilia, for that child is rape. So quite a lot of them will have serious psychological problem. So it can never be a good outcome for the society. Society should frown completely against it, and for us to have a better society.
Now, understanding pedophilia, it's from what you said, it's more like an illness. You said it's a mental health situation. How can we then address it from the perspective of it being a mental health situation? Because at this point, you can't really, attack them as as criminals per se. So we have to maybe address them as patients themselves. So how can we, see this in quote criminals, but yet address them as patients?
Yeah, you are right, but not absolutely. Let's look at it in a very broad way. The fact that some people have some psychological deficits or psychological disturbances and put us on behavior does not mean they have not committed crime. Yes, it is abnormal behavior. Yes, if you have realized you have that problem and you want to get out of it, we can help, we can work with that person, take the person through therapy, and it will be fine. But at the same time, he's committing crime, and he has to pay for that crime. So what we need to first understand is that there are some mental health condition that does not exonerate person from their behavior. You understand? So the fact that yes, something is an abnormal behavior, is recognized to be illness, will not automatically exonerate you from facing the social justice system of that behavior. I have been to court as an expert witness to defend some patient on many occasions. So it's not an automatic thing. I must be able, or the expert witness must be able to convince the judge that what this person did is completely not under his control. You understand? This pedophilia, this sexual preference disorder are not exactly like that. They are not psychological condition or mental illness that take away your reasoning completely. You can control it. So if anybody is caught, he will face the full wrath of the law. You understand? It's different from when you are now saying somebody is psychotic. I once had a psychotic patient, grossly sick psychotic patient, who killed a woman in a neighborhood in this Ondo state and had sex with her dead body.
Wow.
And was arrested. Are you getting me? While in police custody, police started noticing some behavior, and some lawyers, there's this organization HATE, they call them HATE. I think they are under government, but a group of lawyers, when you don't have money to take lawyer, they step in for you. Some of them happen to have met me before, now called me when the police said they should treat, and in court I have to go and speak for that, and I was able to convince the judge that this is the reasoning of that patient is completely collapsed, and that is not in any control. And even if, and it's true, because he killed the person right in the public glare, was trying to have sex. It was not like he was dodging to escape any, and that alone is already showing that he will not have be able to. But some of these pedophiles, they will not do it in the open. They will not do it when their wives are there. They will not do it when they've parent. So they've not lost their reasoning. It's just their gratification that seems to overwhelm them, and they want to disregard completely the social norms or the feelings of their victims and the people around them, and just want to satisfy their gratification.
They are lost.
So in as much as abnormal behavior is showing some degree of psychological deficit, but it is a crime that they must face the consequence of their crime.
I would really like to have more discussions on this, but time is already kind of against us and we have to progress on the show. Maybe we are going to have a part 2 or maybe a part 3 and discuss many more of the social vices, but then it's been a very productive discussion actually. I think to a very large extent, even as a parent myself, I'm already beginning to have 1 or 2 ideas on how to ensure that I protect my own family. Thanks so much, Dr. Akinwumi and Akinnuoye, for being a part of this discussion. I hope you as well has learned a lot. We need to check all things in our society and ensure that this, well, does not see the light of day in the society, because of, I think it has more negatives than on the positive. But
it has no positive at all. No positive at all.
There is no positive at all to this. So we'll still check further and just have more further conversations to this. But then it's time to go for sports. I know many of you enjoy sports a lot and you are already excited because we're already going into the weekend. It's also a time for more sports activities. So let's enjoy sports. When we are back, we'll say our goodbyes. So stay with us, we'll be right back.